understood the health disparities that are unique in Chester that don't exist anywhere else across this Commonwealth, I don't think that they understand that. They have a responsibility to us, and we're going to hold everybody accountable to make sure that our lives are just not thrown in the wind. It's not acceptable. It's not acceptable. So after I submit this grant, I'll be writing my letter, and so I just don't see Chester without a hospital. I just can't accept that, and so I'm going to do as much as I can do to advocate. So just please know that. I'm going to do as much as I can do. And the mayor, he is right on board, and so we got y'all. We're going to see what comes out of it. So that's all I will say. I do want to ask, because I know that this is a very emotional time for everyone, I do want to ask Chaplain Lisa Dennis to come and just give a message to our spirits, please.
Greetings. Good evening. I come to you tonight representing compassionate care from our chaplaincy. My hope is that this prayer can provide comfort, strength during these uncertain and somewhat difficult times by fostering a sense of connection with a higher power, and that this session will offer hope and guidance. Though many have come with questions, we are here to express gratitude. We are also here to express and thanks for the years of professional work and services that have been provided by our Crozier Keystone system, and to the many people who benefited greatly from the services as a whole. So will you join with me and bow? So unto thee, O God, do I lift up my soul, to reverently acknowledge you. This day and days leading up to this day is no surprise to you. We look to you. We look to you for strength and courage to help the decision makers to navigate through these challenges. And after this session, we thank you, Lord, that we will have a stronger mindset and a sense of support. We're praying for peace and comfort that can help alleviate any anxiety and stress that comes with sudden change. As we gather together, we ask that you would be with us, lead and guide us. We pray these things in your name. Amen. Amen.
Thank you. And next we will bring up Laura Werner, who is the director of the Delaware County Health Department, and whose team is responsible for having us all here today. So thank you so much, Laura.
I gotta say, we are here because of your Dr. Motley. She said you have to come to Chester. So that is a lot. Mayor Moots and Dr. Motley are really advocated that we be here. I know none of us in this room wanted this to happen. We're not responsible for it happening. But we want to be able to, at least if there's any piece of information we can give you to make any of this less stressful, that's why we're here. I know that you will raise questions that we won't necessarily be able to answer tonight, but we're going to do our best to share what we can and make sure that what resources we do have available to you, you know about. So thank you for coming. We appreciate this very much. And I'll pass it to Dr. Key, who's going to introduce the panelists.
Good evening, everyone. Thank you again for being here. Again, as my Director Werner stated, this is not necessarily, and I'm sure that questions will come forth about closure. We do not have all of the answers. And towards the end or during this event, if we are able to, we will answer any questions that we can. However, this is more of a conversational environment, a forum where you can learn about many of the resources that we have in Delaware County. Oftentimes we realize that people are unaware of the resources that you actually have and that you can tap into. So this is an opportunity for you to learn about some of those resources from our awesome partners here, and also maybe get access and information in reference to other resources. In addition to the wonderful professionals that we have up here, we have a table full of references and resources in the back. So I ask you to take as much as you can, in addition to what you learn from here, and feel free to tap into call those resources or call our wellness line if you have any questions regarding to those. And we will do our best to connect you with those resources. So in no order, I will introduce, I'll try to do it briefly, all of our public health professionals that we have up here tonight who have taken the time to come here and present the resources that their organizations have, but also to answer the questions and hopefully quell any concerns that you have. Understanding that we are very grateful, DCHE is very grateful to these panelists, as we did have one of these before, and they took the time to be there and answer your questions, and here they are again. So it's just a testament to the work that we do and the sacrifice that many make without attention to it. So first I want to introduce Stacy Nawn of MVP Recovery. Stacy Nawn is a licensed professional counselor with a master's degree in community counseling and postgraduate certification in mental health counseling from Wilmington University. Stacy began working in behavioral health field in 2008 in Delaware County. She started in case management, where she supported individuals navigating complex mental health and substance use challenges. Her passion for direct client care led her to transition into a therapist role, specializing in delivering evidence-based treatments. Over time, her leadership skills and clinical expertise guided her into management positions in behavioral health. With extensive experience across various levels of care, including assessments, outpatient, inpatient treatment, program development, Stacy brings a comprehensive understanding of behavioral health services. She is clinically trained in cognitive behavioral therapy and motivational interviewing, approaches that inform her commitment to evidence-based practices. Currently serving as the Regional Director of Treatment Services at MVP Recovery since June 22, Stacy is dedicated to addressing the impact of substance use disorders on individuals and communities. She focuses on developing innovative client-centered programs that remove barriers to care and prioritize accessibility, efficiency, and quality outcomes. Thank you, Stacy, for being here. Again, forgive the order. Then we have Meg Grant from Keystone First. Meg Grant is the Director of Public Affairs and Marketing for Keystone First, Pennsylvania's largest Medicaid managed care company. She specializes in developing innovative solutions to improve health outcomes for low-income communities. Meg has a degree in business management and graduated in executive leadership. With over 35 years of Medicaid managed care experience, Meg brings her relationship savvy, compassion for the underserved, and her vision for leadership to assist her team in breaking down the barriers and removing challenges and providing access to care. Meg has served on St. Christopher's Foundation Board, the Family Support Line of Delaware County, and is currently serving on the Chester City Health Board and Delaware Community Health Board. Meg recently launched the Keystone First Wellness Opportunity Center at 1929 West 9th Street in Chester City. During the pandemic, more than 15,000 vaccines were provided at the center. Meg was also responsible for launching the Mobile Wellness Center, which travels throughout the 5-county area. Both mobile and brick-and-mortar centers offer programs and services to supplement programs that are currently lacking in low-income communities, including art classes, exercise programs, and food and diaper distribution. She believes that every person in life wants to be successful and productive. If they are not achieving this, there is something that we can do to help. Meg, thank you for being here. Then we have Laura Krugler from the Delaware County Department of Human Services. Laura Krugler grew up and resides in Delaware County, Pennsylvania. She graduated from the University of Scranton with a degree in psychology. She spent her first 3 years of college working in mental health field as a direct care staff for wraparound services in a residential treatment facility. In 1999, she started working as child welfare caseworker for Delaware County. She continued to work in child welfare for the next 19 years in different departments, learning about local community services, foster care system, and the many moving parts of physical health, mental health, and educational systems. In 2018, Laura returned to the mental health system in Delaware County's Human Services Office of Mental Health, overseeing local publicly funded mental health programs and services for Delaware County youth. Laura, thank you for being here. Next we have Dr. Jameen Patel, CEO and owner of Woodland Pharmacy, as well as owner of the Delco Behavioral Health Clinic. Dr. Patel has served Delaware County since 2000 and was instrumental in Chester during the COVID-19 pandemic. She is a pharmacist by trade that has a passion for mental health and has recently been working to open a mental health clinic in Swarthmore. She has worked closely with Rosetta Carter, Ms. Carter, shout out, and the Chester community, and strives to make a difference in Delaware County. She received the President's Award and Lifetime Achievement Award in 2024. Her lifetime goal has not been just to spread awareness in the field of mental health, but to have a clinic of her own where patients can come for help and feel good about themselves and the community they live in. Dr. Patel, thank you for being here. Jean O'Brien from Penny Outreach and Education. Jean has served in education and social services within Montgomery, Philadelphia, and Chester counties for over 40 years. Her current role surrounding the American Care Act has brought her to Penny. She shares education sessions, collaborates with local legislators, and presents at healthcare-related events across PA, focusing on the Southeast. DCHD has joined forces with Penny within the wellness programs offered and is scheduling on-site appointments with certified Penny enrollment assistant. Please connect with Jean if your organization wants to learn more about state-based insurance exchange. Thank you for being here. Amy Martin from the Foundation for Delaware County. Amy Martin is a Nurse Family Partnership Program Director for the Foundation for Delaware County. She has been serving Delaware County residents since 2000. While working at Crozier, Amy transitioned to the grant-funded Nurse Family Partnership Program in 2008. She is inspired by the dedication and advocacy of her foundation team, the families that welcome home visitors into her homes and their lives, the program's mission to improve maternal and child health outcomes and address economic instability. Amy will share more information about the Foundation for Delaware County's public health programs. Amy, thank you for being here. And last, but certainly not least, Ms. Sheila Church from Chest-Pen. Sheila Church is a senior leadership team member at Chest-Pen Health Services. Chest-Pen is a network of 3 federally qualified health centers in Delaware and Chester County. Sheila has worked for Chest-Pen in a leadership role for 34 years. As Director of Patient and Community Services, Sheila manages the programs and teams that enhance healthcare delivery by fully integrating social services, patient health education, and community engagement to meet education and to meet the organization's mission. Sheila has a master's degree in adult and continuing education and is certified by the Pennsylvania Certification Board as a certified advanced alcohol and drug counselor. Sheila shares her goal is to remain as active and valuable contributor to the community she was born into and raised in. She served as the chair of the Chester Housing Authority for more than 10 years and is also a City of Chester Health and Board member. In 2023, she became a Black Equity Coalition Ambassador to address inequities for the well-being of Black communities. Sheila, thank you for being here. wait, one more, sorry, my fault. Last but not least, Ms. Kimberly Jones. She is the current clinical director for the Delaware County Crisis Connection Team. She has been in this role for 2 years now with 10 years of crisis experience. And she is also joined by colleagues in the audience. Kimberly, thank you for being here. And so this is just a brief introduction to the years, decades of experience that is up here tonight for you. So without any further ado, I will turn the mic over to them for them to share a little bit about their organizations, what they're doing, what services they can provide, and after that, please, I encourage you to ask questions.
Good evening, everyone. It's a pleasure. Good evening. It's a pleasure to be here and also have the ability to share with you what we do at Chespin Health Services. Chespin Health Services is a federally qualified health center. We opened our doors in 1973 as a clinic in Chester, right, located on 9th and Potter Street in a trailer. At that particular time, we were only providing services to pediatrics because there were a lot of children in the city of Chester who was uninsured and did not have the ability to go into a private practice for care. So we started providing services for kids at 9th and Potter Street. We also spent some time in the Old Rotary Church. And so Chespin has been around in 2023 for 50 years. So we've been here for more than 50 years now. Chespin Health Services right now is located at 125 East 9th Street, which is right next door to AutoZone. But Chester, when you hear about a federally qualified health center, I think it's really important that I explain what a federally qualified health center is. In 1982, Chespin became a federally qualified health services. What we noticed that when our community needs grow, we needed to grow as well. So a federally qualified health center is a community-based health care provider. We provide not only primary health care, but we also provide social services. Our goal and our mission has always been to provide services to those who are in need. We don't care about whether they're insured, whether they're uninsured, and we don't care about their immigration status. A federally qualified health center is supported by HRSA. However, we also help individuals who are uninsured to get insurance. We apply through the Department of the County Office of Assistance. We also apply through, we are certified penny assisters who can apply through the state insurance platform. I go now? Okay. Through the state.
That's right.
Can you hear me now? No. Great, you can hear me now. Wonderful. I was told I had a radio voice years ago, but that's okay. But Chespin has been around because it's always been important that we provide the services. I'm out again. Can you still hear me? No? I don't know, I guess it's the mic. Still can't hear me? Well, I'm going to talk as loud as I can because I don't think it's going to work. Okay. How about this? Still can't hear me. It's the mic. It's the wire. It's the wire.
Just keep on.
Okay. So as I've said, we are supported by HRSA, but we also help individuals acquire health insurance through applications through the County Office of Assistance and also through the penny. Chespin's goal is, and our aim is to provide comprehensive services. We not only provide medical care, we provide dental care, and we provide social services. And social services we refer to as enabling services is what sets us apart from a private practice. I have one of my social service coordinators here tonight. She's one of Dr. Motley's senior students now. But however, she can tell you how busy we are trying to make sure that we address those things that we think can be a barrier to anyone's care. Chestnut is not closed, we're open, we plan to stay open forever if we can, because we are really concerned about making sure that individuals in underserved communities get health care. Chestnut, we are open for new patients. We do have a community health worker who's out in the community. She's at Catholic Social Services, she's at the food banks. But anyone who is uninsured can call, anyone who doesn't have a primary medical home can call Chestnut. You don't have to have insurance. We don't care about your immigration status. We do serve the immigration, folks who are not United States citizens. We provide care for those individuals as well. Currently, we're okay, good. So as I shared with you, we are located at 9th and Crosby Street, right across from the Social Security building. Our phone number to call for an appointment is in our brochure, which I have plenty of brochures on the table, but medical is area code 610-872-6131. Our dental practice is area code 610-874-6231. Now, what we do provide there at Chestnut, as I said, is primary health care, comprehensive health care to adults, families. You need numbers again? I see somebody's face like I didn't hear that. You okay with it? Still can't hear me? Okay, now you can. Okay. All right. So our phone number again is, and I do have brochures, and the back is for medical care is 610-872-6131. Our dental practice is 610-874-6231. So we are open and we are accepting new patients. There was a rumor saying that Chestnut was at capacity. We are not at capacity. And we are constantly attempting to provide services and gain resources that will allow us to do even more. So we're providing primary medical care right now. We're providing dental. We're providing women's health, OB services. We are providing social services. We are addressing those things known as social determinants of health, anything that could be a barrier, just not want to get in the comprehensive medical care that they need. We have a behavioral health consultant at our facility on 9th Street. We have a community health worker. We have a community health educator. We have preventative programs for those things that we know impact this community, like diabetes and high blood pressure. So we're trying to address those things that we have identified that this community needs. I think I've covered everything, but I think it's really important. One of the other things I wanted to mention to you all is that we also have an in-house pharmacy. So, and we also deliver medications to someone, needs the medication delivered to their home. So we have an in-house pharmacy, and not every federal qualified health center has an in-house pharmacy, but Chestnut does. I don't think that I've left anything out, but certainly I will be able to answer any questions that anyone may have at the end of this presentation with the other panelists on the table. Also, it's important for you to recognize that we don't work alone. We don't work in a shallow. We also work with everyone here at this table. We are affiliated with everyone here actually at this table. And so we want to make sure that we are accessing those services that are available to serve the citizens of the city of Chester. Thank you.
Hello, good evening, everyone. Can you hear me? Yeah. So my name is Jamie Patel. They call me Jamie, it's easier. I have started my pharmacy career in 1994. I worked for big corporations, Walmart, for many years. And then I decided to do something in the community of my own. And I ended up buying Woodland Pharmacy. That pharmacy has been there since 1952. I took it over in 2018. And, I'm glad I did. To get the satisfaction of what you're doing in the community, you only get it if you are involved in the community. I have the pharmacy for 6 years. Right now, what's happening, Chester Health System closing down, we've been getting a lot of phone calls, right? Because everyone is panicking where they're going to get their prescriptions, how they're going to get in touch with the doctors, and things like that. Me as a pharmacy owner, I am going to, assure you guys that we are here, myself and my team, is to take care of the patients, right? If it is where you do not have the, anyone don't have the refills on a prescription, we're going to make sure you guys get the medication, to hold you guys over until you see a physician, right? We do blister packing for elderly, right? So we do the monthly packing, we do free deliveries for our patients, right? So anything that we have to do to make this time, easier for you guys, that's our goal, right? I have informed my team today, in the morning, we at least got 30 to 35 phone calls, right? Just because everyone is panicking, they're afraid, right? And what I see is a lot of patients who are really, really stressed out are the, mental health patients, right? Because they are seeing the patient, they're seeing the doctor once a month, and they don't get refills on those prescriptions. So now they're wondering what's going to happen next month, right? So, I am a pharmacist, but my passion was always to work in the mental health, in the mental health field. And so last June, I had decided to open up a mental health clinic. And, we are at the final stage of it. It's going to be open, it's called Delco Behavioral Health. It's going to be located in Swarthmore, Pennsylvania. I have a great support from Delaware County Health Department, Rashida Williamson, Dr. Kay, Laura, Mona. They are all helping me out. We are at the last phase of it. We just need to finish a few things and we'll be able to open. We do have a clinical director on our staff, Dr. Eric Suarez. He's in the audience. He's my clinical director. We have the 2 medical directors. We have 3 therapists already on board. Anybody from Crozer Chester Health System is interested in working for us, please let us know, because once we open up, we're going to grow, right? And there's a need for it. So we're going to need more therapists, more, mental health professionals. So anybody who is interested, please let us know. And, we would like to get people from the community. That's our goal. We are in the community. We want to employ people from the community. We want to serve this community. So that's what we are here for. We are going to do it in a way where even if we have to go, somebody had just asked me earlier, will we go to Upper Darby? Yes, we will. If we have to, we'll send the therapist there. If we have to do the telemedicine visit, we'll do that. At the end of the day, our goal is to reach as many people, as many patients as we can, to give them the care that they need, so they can stand up in the community and do what they need to do. Our goal and our mission is to fulfill what they're lacking, right? And make them feel empowered and make them feel confident so they can stand up and do what they need to do, right? So yes, I think I am at a point in my life where I understand both the business, right? I understand the prescription part of the medication part of what patient needs. And I also understand the mental health aspect, for these patients, right? And so our goal is to bridge the two and help patients in any capacity that we can. So any questions, after this panel discussion is over, please reach out to us and we'll be glad to give you all the information you need. We're going to have a one-to-one therapy, we're going to have a group therapy, we're going to have family therapy, we're going to have a psychiatric evaluation done, psychiatric re-evaluation done, whatever it takes, medication management, whatever it takes, that's what we're going to offer and we're going to do. Okay? Thank you.
Good evening. First of all, it's so nice to see so many people I recognize and so many people I've worked with over the years. One thing I wanted to say, and I really appreciate all my partners here so much. But in the beginning, they were talking about all the things that Chester needs, right? We were talking about how we really need a hospital here, how we need healthcare here, how it is a requirement, how But one thing I want to remind us all is that I have never worked in a city where people rolled up their sleeves and we worked together. Everybody in this room I have touched in some way, and they have held me up when, perfect example, Keystone First, the plan that I work for, we used to be called Mercy Health Plan, and I believe most of you recognize that name, right? Because we cover about 70% of the people that live in this city. About 13,000 members we're responsible for. But the one thing I want to say is right before the pandemic, I would say, I think the day before the country shut down, the wellness center, our wellness center, lights went on. And the one thing I want to say, if it wasn't for so many of the people in this room, including the health department, including the city health board, including Rosetta Carter, if it wasn't for the little mighty engine that could, right, we would not have had 15,000 people vaccinated. So one thing I want to walk away with tonight, because we're all feeling it. We're feeling it. If you don't see it, if I'm smiling, you need to know. Not many of us are sleeping. We're upset. But we are here. And we are not leaving. And our doors at the Wellness Center, which is located at 1929 West 9th Street, right next to the dollar store, will be open from Tuesday through Saturday. And from Tuesday through Friday, we will have at least 4 ambassadors there from 9 to 5. We have computers. We have people who know how to navigate. It is very difficult for me to give you one-word answers about things, but I'll try to answer them the best I can. But if you have individual issues, problems, family members you're worried about, I brought lists of PCPs, providers that you can see. If your current doctor is with Kroger, I bought specialty lists. We want to help. We want to be part. Don't take this home. Come and find us. And Deirdre Cresta's here. Thank you, Deirdre. She'll be working out of the center. We'll have several other folks working out of the center, but we want to make sure if you have questions, like I said, 13,000 members we're responsible for, who we're probably using Kroger for the most part. We want to figure out how we can help you out. We're trying to put some things together to put in place to make sure transportation, other things that we're talking about 24/7 to figure out, what is the best way to make sure that you all are taken care of and that we continue to live this beautiful community that I live and help support.
Testing. You guys hear me? All right. Thanks so much. It's so great to see everyone here tonight. My name's Amy Martin. I work for the Foundation for Delaware County, and I'm going to talk about our public health programs. We primarily serve families with young children, and I'll start with our WIC program. I think most people have heard about WIC. For those who are pregnant or have children under 5, we have 3 locations here in Delaware County, and we urge everyone to access those. One's in Eddystone, one's in Springfield, and the other one's in Upper Darby. I'm also going to share information about our home visiting programs, because now more than ever, families need our help. And so we have 2 home visiting programs. One is Nurse Family Partnership, and the other one is Healthy Start. Healthy Start started here in the city of Chester over 30 years ago by our Chief Impact Officer, Joanne Craig. We have community health workers who work with families during pregnancy and up until the baby is 18 months old. We do a lot to support those families during that time. And now, more than ever, you can imagine how families will need support accessing health care, making sure that they're getting to their prenatal appointments, providing education, providing information about food, bringing diapers. The list goes on and on about the work that our community health workers and also our nurses do in Nurse Family Partnership. So we're able to serve the whole county. through our services. And there are eligibility requirements. However, we're not the only game in town. So if we can't serve someone, we will refer out to other programs. And there's programs on the other side of the county as well. So we really try and make sure that no matter what, families are getting the services that they need. So with Nurse Family Partnership, we have 9 nurse home visitors. They each serve about 25 families at a time. And most of the work happens in the home. And it's really an important level of trust that the families build over that during pregnancy and up until that baby turns 2 years old. We focus on mom's health during pregnancy and after, and those warning signs that come up. We know that maternal mortality is shockingly high here in the United States. And that is something that we address, and then also infant mortality as well, and then that baby's health and development. So I mentioned that we've been here for over 30 years in Chester, and during that time, as the needs of the community have changed, or as we've identified gaps in services, we've brought aboard other services. So we have our home visiting services. We also have a Moving Beyond Depression program, which provides in-home cognitive behavioral therapy and other therapy services to parents with major depressive disorder. One of the big barriers we've seen for our moms is really accessing those therapy services. Imagine having an infant or a toddler in tow and you're trying to address your mental health. It's not easy. We also have a fatherhood program that we recently brought aboard. So dads who want to be more involved and get support from a fatherhood case manager can get that support as well. We also have doulas now, which, you know, when you're going in to have a baby, having the support of your own doula. If you haven't heard of a doula, it's the hot word we hear these days. So, but basically, it's someone to support mom during birth, and dad as well, or partner, whoever's there. They're there to really support and make sure that mom's getting everything that she needs during that birth. And you can imagine right now, if you had to change your provider right before you're about to deliver, how important it would be to have that support. If you were to say, go to a hospital that you weren't familiar with, have a new provider, deliver your baby. But if you have your doula there with you, you have someone who knows you and who can advocate for you. We also have some housing supports. We have a medical legal partnership so we can remove any civil legal needs that our families face. A lot of times that's accessing utilities or other benefits that they're eligible for, but there's so much red tape to get those benefits. So I could go on, and so I don't want to sit here and take up too much time, but if you know someone who's pregnant, which most of us do, or maybe just had a baby, please refer. Our information's in the back, and I'm happy to answer any questions. And before I go, though, I can't not mention that we also have El Centro, which is for our Spanish-speaking community. There's more information in the back about El Centro as well, and some of our case managers are bilingual, which is really important too. And so I didn't want to neglect to say that. Thank you so much.
Hello.
Does that work? Hold that up. Oh my gosh. My name is Kim. I'm the clinical director from the Mobile Crisis Team. So we're also known as the Delaware County Crisis Connections Team. Yes, you're gonna have to use it. Why does it work for you? Only you stand up So I'm the clinical director for the Delaware County Crisis Connections team. I'm not sure if anyone's ever called crisis before, but the way that it works is anyone who's experiencing a mental health crisis in Delaware County can give us a call, or a family member can call. So we are able to go anywhere inside of Delaware County and meet with you to kind of help resolve your crisis and provide support. So we go to schools, police stations, homes. I've met with people at Dunkin' Donuts. I've met with people on the street. So we really can go anywhere inside Delaware County. So when we get out there, we do a couple assessments. We do like a suicide assessment and kind of see where the person is at. And then we would provide a level of care recommendation. So whether that level of care recommendation is mental health outpatient, all the way ranging to inpatient treatment. So we can provide referrals to the higher levels of care, such as partial hospitalization and inpatient treatment. We're also able to transport individuals to the hospital if they're voluntary and willing to go to the hospital for a 201 assessment. And then if someone is not willing to go to the hospital and is in serious danger of harming themselves or others, we can facilitate the 302 petition. So we do a wide range of things. We can provide resources for drug and alcohol services, homelessness services. We really see anyone that's experiencing any kind of crisis inside of Delaware County, and we try to support them as best we can. And also family members and things like that. Thank you.
I'm going to try this, but you probably can hear me anyways. So my name is Laura Keebler, and for a good portion of my career, I was a CYS caseworker in Chester for 13 years. So Chester has my heart. I remember taking kids to Crozier when they were little babies. And for the past 5 years since the pandemic, we have been working at the Delaware County Office of Mental Health to expand our services. Come up with more providers to be able to fill in the gaps. So we're not relying on just one provider. So there's many, many programs out there, and we are working with all of our partners to help everyone access services. We have multiple programs, including Delaware County Delco Contact, which is a family peer navigator, because I know it's stressful to find services for a child that you love. So that is through Child and Family Focus. It's a family peer navigator, so someone who's been through the system with their child can then help you find services for your child. So it's no insurance required. You don't need to have a diagnosis. You just need to be looking for mental health services for your child. We are here to help as much as we can. We are working to build partnerships with everybody in this room, plus each and every one of you, because we are trying to build a system of care and try to help each other. I know this is going to be hard. We already have wait lists, and we're working to lower them as quickly as possible. All of our providers, including Elwyn, including MVP, and all the other providers in the room are trying their best to hire staff as quickly as possible and help some of the staff that's coming from Crozier to go to other places. So we hope for your patience and understanding as we all try to work to help access the services. And we have many, many, many providers out there. We are working with our new managed care organization and CCBH to find more and more providers and more services every day, and to look for those gaps in the services. So I thank you for being here tonight. We hope to provide more help and more support as we learn more information and find more providers. And thank you all.
I don't know if this is going evening, everybody. I'm Stacy from MVP Recovery. I thank you all for taking the time to come out and have this important conversation with us as we navigate through these difficult times. What I want to share is MVP's been in operation since 2014 and actually was established as a sober living program here in the city of Chester. It has continuously looked for gaps in the community and in the services and continued to expand. So during the pandemic, what MVP noticed as an organization was it was a time of isolation and people were not, getting treatment in person. They were not going to meetings. And that was a good opportunity to offer outpatient treatment services at that point, which they did. And we were able to open in media at that time and have since expanded to 2 locations in Chester at 2200 Providence and 2334 Providence Avenue. So we've continued to see the needs of our community, and what we have looked at in addition to treating substance use disorder is we've added outpatient services for mental health. We do not have a wait list. We have med management, we have psychiatry, we have CRMPs on staff that can prescribe medication. We have group and individual counseling. So we are able to offer treatment for mental health and substance use disorder immediately. So we have one main number, that's the one great thing. So you can just call us and we will help you navigate what linkage you need. Another big component of what MVP does and has always believed in doing is being on the front lines and in the community. We align very strongly with our community and with our partnership with the county's Department of Human Services. We offer a lot of community-based programming that it doesn't matter if you're going to come into treatment with us, it doesn't matter what your insurance is, we're there to help, and we are there 24/7. So we always will have a certified peer specialist or certified recovery specialist answering at any day of the week, at any time, to help an individual navigate, whether they're coming into treatment with us or we're helping them navigate where the next steps are. That's what we're there for. We are out in the community. We will be hospital side. We will go to a Wawa. We will go to a school. We will be wherever we need to be to help meet that person where they're at and help them navigate the system that can be overwhelming even prior to the current events that we're experiencing. In addition to that, we do have a walk-in center. It's called our STAR Center. And that is what I like to refer to as kind of like a minute clinic or a behavioral health urgent care. It is not a crisis center, but we can stabilize and screen for mental health, substance use disorder, and even some medical needs. That individual does not need to have any kind of insurance to come in and meet with a nursing staff or a recovery specialist or a counselor. We will help them apply for benefits. We will help them research a primary care doctor. We have psychiatry available 24/7 if we need to consult or see if we can do some kind of bridge order of medication. This is located at our 2200 Providence Avenue, and that is 24/7, holidays and all they need to do is walk in. They will be greeted by a nurse, they will be sat with by a peer or a recovery specialist, and we will keep them. We have food, we have different things available to help ease them feeling overwhelmed and help them get to the next step. So there's a lot of brochures back there in our information. The main point I want to get across is you call 855-MVP-2410 and we will answer the phone and we will help that individual with any question, linkage, resources, anything. So I'll be here for questions, and again, I thank you so much.
Not that I need a microphone. I speak very loudly. My name's Jean and I'm from Penny. I'm here today more so to represent the individuals who are losing their roles at Crozer. Know that Penny is a state-based exchange here in Pennsylvania, and remember, it's a purchase and not a program. So we're here to offer great healthcare product that has 10 essential health benefits on every product that's purchased on the platform. In the room tonight, I know there's at least 2 enrollment assisters that can help you enroll on the Penny platform. So The hard part is shopping for the health care insurance. Anybody can fill out the application, but if you need a little bit of help, you can get an enrollment assistant to help you. And you can just call 844-844-8040, and we'll help you find an enrollment assistant. I will tell you that the only gig in town right now here in Chester is Chestnut. So if you want some help, so when Sheila said that she's connected to everyone in this line, she truly is. So ChestPen offers enrollment assisters here in Chester. So if you've lost your healthcare insurance at no fault of your own from losing your job, remember, it's a business decision. You have a 60-day open enrollment period that you can enroll in healthcare insurance. So you got to start shopping soon. Jump on to penny.com. There's a couple pieces back on the table there. My business card is there. I think everybody knows Sheila, so you can always call and get assistance in purchasing that health care insurance. You don't have to go. I think our biggest piece is we've got you covered. Anybody can come onto the platform. We had a nurse who sent a question in today who was told that she wasn't eligible because she made too much money. That's not true. There is no eligibility on the Penny platform. She might not be eligible for financial assistance, but she certainly is eligible to come on the platform. There is no eligibility whatsoever. So know that we're here to help. We have local enrollment assisters. If you want to talk to a local broker, you can just go on to penny.com, put your zip code in, and you'll find a local broker who can help you shop for a plan, because that's the hard part. It's figuring out what plan you want. So just know that we're here to help. My name's not Penny, it's Jean, but just remember penny.com. So now we will open it up for questions. Yes.
Hi everyone, my name is Leisha, and I'm a lifetime resident. First I want to say I appreciate all of y'all up front items. What you guys have to offer is great. However, gotta go here. Somebody have a heart attack, we can't call y'all. Somebody have a stroke, we can't call you. Somebody gets shot, we cannot call you. So I understand we have you guys as a resource, but the crisis we have, you guys cannot handle. So I appreciate y'all, because I'm definitely coming. However, we got a bigger issue than, Planet Chester honestly has been a dump area for some mental health issues. So we definitely going to need you. But we get somebody, I can't put a stab victim in my car in about 40 minutes to a hospital. We're going to crash because I'm trying to save a life to get them to save their life, and we both lost our life. This is bigger than a Band-Aid. Peroxide can't fix this. This is real. I appreciate y'all, but this is really bigger than going to ChestPen. It's bigger than that. I can't drive to Christiana, Nemours, Chop, Temple, all of them if somebody gets shot. I'm going to get pulled over for doing 90. Now I just wasted 15 minutes of somebody's life, because now I got to fight with the state trooper. We got a bigger crisis and everything that's available to us, it's not here in the city of Chester. We got to go on the outskirts. Having people have transportation to get there.
My question is for Meg, because I know she didn't bring it up when she was discussing her part on the panel. Meg, can you explain the kiosk station?
Yes, I'm so glad you mentioned that. Thank you again, Delaware County Health Department, for coming for us. So, the power of partnership, right? So outside of our building, we have a kiosk, and it is free for all to use. And there is no limit on how often you can come. Nobody's making sure that you're not taking too many. The kiosk is It has everything, and I'm gonna try to remember. Oh, I don't even have to. She happened.
I got you, girl.
So the kiosk has condoms, gun locks, harm reduction kits, COVID-19 tests, flu A/B test, RSV test, tampons, pads, first aid kits, HIV test, emergency blankets, and rapid antigen COVID-19 test. Oh, and naloxone. I can't say.
Narcan.
But Narcan, thank you. And I mean, one of the things that was so awesome to me was that they came through when that chain pharmacy, I won't mention names, closed their door, right? So we are so glad, but we really want you to use it. It is so easy to use, and if you go between the hours of 9 to 5, we are happy to come outside and help you use it. But I will tell you, you use it once and it's a piece of cake, you'll use it a million times. One of the things, if I can say this, which maybe it's not the right thing to say, but use it. It's there, and I worry that, well, I know the county won't do this, but I worry that it'll go somewhere else. I want it to be in the places where people need it most. So please use it and spread the word. And one other thing I wanted to mention is we also, thanks to a lot of our partners, we have free painting classes at the center. We have free yoga and Zumba at the center. Everything we do there's no cost. We have computers for you to use. We have all kinds of stuff. Please come see what we're doing. If you need diapers, you know somebody who needs diapers, we have diapers, we have food. Come down and visit us and see. And we just did our pre-prom expo. We just outfitted close to 30 kids for the prom this year, which we're really excited about. Next year, I want to have over 100. And next year, if anybody has prom dresses after this season, please, or tuxedos, you should have seen some of the young men in their tuxedos. It was amazing. Denise, go ahead.
So I want to back to what Michelle was speaking to.
Of course.
And catch it. So go back. Hi everyone. I'm Denise Martin. I work with the Foundation Delaware County. Piggyback off of what Lisha was saying, with being in the city, born and raised. We do have problems, the gun violence. We do have people who may have heart attacks, seniors and all that. I was wondering if Chest Pen would be at least a place they can go before, to call the ambulance. If someone's having a heart attack, and they walk in with their family member themselves, would they be able to come into Chest Pen and then Chest Pen just help, because there's doctors here. And it's a temporary hold until we can get to the next stage. At least we're saving them. So I was wondering if Chest Pen, is that something in the future or in the plans for even a gunshot victim? If they can come walk in, and then be seen by doctors before, at least we could at least stabilize them until an ambulance is called or until they're able to get to a trauma center.
I'm not sure I have the right answer for that right now because Chest Pen providers, Chest Pen doctors are not trauma prepared providers. It's different.
Thank you. Thank you.
So, I don't think we can do that.
Yeah. I said something that we talked about
Hi, my name is Deborah, born and bred here. Started my career at Crozier and ended it here about 5 years ago. So as far as for emergency things like gunshot wounds and stuff like that, there's still going to be ambulance service here to get you to where you need to go. Now what you need to know about an ambulance is that it is a rolling intensive care unit. You're going to get good care in there and they're going to keep you as stable as they can until the person gets to where they need them to get to. As far as going somewhere, do you all remember the DC sniper? Well, one of the children that was shot that he just decided to shoot, it was an urgent care to save that child's life. And so you have to remember that we do also have urgent cares. If you can't get anywhere else, and you can't get an ambulance to come get to an urgent care, because they're more equipped than Chest Pen, which is more like a doctor's office, to take care of that and to keep you stable. So see, sometimes the name of the game is keeping a person stable in that first hour until they can get them to where they need to go. So ambulance service, there are people that are going to step into that gap.
Talking about urgent care. If you ain't got $50 in your pocket, they're not gonna wait on you. I went up there last week to take a COVID test. Because I was around some people had COVID. And they wouldn't take it. I give my insurance company, they said, I feel like paying $50. If you ain't got no money, they're not gonna wait on you. I went to Brookhaven, I went to 196 High. Now if you wanna know something, they took the bill, a big place I tell you in Aspen, across from the skating rink. That would be for like a clinic or something. And you can stay overnight in there. They built one out there on 202. They got one right across Jersey, Tommy across there on 55. A big place for Jefferson and Keystone. They're building a lot of facilities where you can go. But you need a hospital in this city. I still got confidence. I still got confidence this hospital will fill. If you ain't got no confidence, you just like a dead person. Because they got 7 or 8 more days. And anything can happen. If all them people go and call the president, here, they're spending billions of dollars in the foreign country. You mean to tell me they can't spend $100 million here? Something wrong, but you got COVID, man. You actually nothing, you get nothing. It's like eating meat and bread. If you don't fry, then you won't eat nothing.
I walked into what my question is. I benefit from the mental health department. And I just want to know, if I have a crisis, where am I going? Oh, I'm sorry. I came in late, so I don't know if you already addressed this. If I have a crisis, where am I going?
So if you call the mobile crisis team, we can come out and meet with you.
How are you doing, Kim? Just talk with me.
Not reaching to go over the table. So if you're
Let me say this. I am a part of the mental health department. You have helped me. Program has been a blessing to me. What I want to know is if something happens, if I go into a crisis, where am I going to?
So we're a diversionary program. I mean, that's not working for me. We're a diversionary program, so we're going to try and divert from the hospital by all means before we're going to talk about hospitalization. So we'll try to do some crisis planning and come up with some ways to mitigate any future crisis. If the hospital is what needs to happen, since we're not going to have a crisis center in Delaware County anymore, we have a couple of resources that are outside of this county. We have Haven, which is a great hospital. They're in Westchester. There's the Rockford Center down in Delaware that we refer people to.
But you all talk about places. People need transportation to get where you're talking about. You guys are so convenient right there that, you know what I mean? If you got to walk, you can get there. Anybody can get you to Crozier. Well, who's going to get me to Delaware?
So we can, if you were to go to, say, Riddle or Fitz to do a voluntary evaluation and that doctor determines that hospitalization is appropriate, they would set up ambulance transport to a hospital.
Okay, thank you.
Can I add to that? So, I just wanted to add real quick. Although we're not a crisis unit at our STAR Center in Chester, if you are feeling like you need a higher level of care or you need a psychiatrist, you can walk in, and we do have peers there. We can link you to anywhere, on a voluntary admission, and we do have transportation available for you.
Thank you.
Yep.
All right, I'll be like, hi, everybody. I just want to say a couple of things real quick. I'm supposed to be on my Zoom. We appreciate you all for coming here and for the many trees that you all have cut down to provide us with this literature. Real quickly. Hold on, y'all, we can't hear. Oh, you can't hear me? Okay, now they can hear me. Listen, we need some we are at a 10-alarm fire, okay? And I think that Delaware County Health Department, we need all the resources financially that you can give us. We need to have a mobile clinic here, opened up 24/7. We need resources to go into the one urgent care that we do have. Let's divert some of that money from Delaware County down here to the city of Chester, because you got a lot of the money based on our statistical information of poor health and poverty anyway. So let's get that money redirected into our community. Our greatest fear is that we know that we will have people dying on the way to health care. And that is scary because, it may be statistics for some people, but we know all of these people that are going to be in crisis. So although, I'm appreciative of you all telling us what you all do, this is what we need for our community. Immediately some type of ambulance service so that we're not reliant on the other communities, because we all know that's going to last a hot second. Okay? A hot second. MAGA going to step in and that'll be the end of that.
Yes.
So let's tell the truth about it. So we need immediately some ambulances. I don't know why we can't force Prospect to give us the ambulance. We'll find the EMTs, okay? We'll get people trained because they're already trained. People get up every day and leave out of this community to go take care of somebody healthcare wise. So we know what we can do. Thank you.
Okay, Dickie Robbins, a pastor in the city and also social worker at the Chester Education Foundation. What I'd like to say is this crisis was thrust upon us. People who showed up tonight are here attempting to be a part of a solution. I don't think we can afford to negate any possibility or any service or any support that is offered. We don't have an immediate ideal situation. We have to build that. And if we can all get on the same page about what the need is, what the resources are, and work together, I believe that we can build a system that will at least bridge the gap. Now, I do know that there are some things that will be announced and will be shared, including ambulance services for Chester and all of that. But this is just beginning to be addressed. So as much as people don't like to hear it, patience is going to be required. Okay? There are a lot of people who are working around the clock. Okay? I'm involved not just through my role as a pastor, but also working as a social worker through the Chester Education Foundation. And I'm not alone. There are so many professionals. We were contacted, Councilwoman Williams and I were contacted. There are physicians out of Philadelphia, out of Jefferson, who want to know how they can help. People are going to start to come forward and help meet the need. All I'm saying is, be willing to give your input, but let's not be critics. Okay? Either we're going to be a part of the solution, or we're going to be part of the problem. Okay? So let's work together and make this a viable solution. I thank everybody for coming to be a part. And we're not in a position right now to turn down any help or any support.
Good evening. My name is Jocelyn Morales. I serve as a school board director here in the city of Chester. I wanted to add to what Ms. Lulene said about the mobile unit because we do have an organization, community capacity builders under the leadership of Ms. Jenny Chang. I had opportunity to sit in on a listening session with them, and they are interested in having mobile units here in the city of Chester. This was way before the situation with Prospect took place, so I think it's worth the community engaging with them. They will have public meetings announced over the next few weeks for how we could be of support to them and how they can be of support to us. I know they're waiting for funding from Delaware County Council, so I would ask that if anyone has the authority here to accelerate that funding, that the funding be accelerated. I also wanted to speak to the urgent care because several people have mentioned urgent care as an intermediate, but it's not open all day. So if you want to offer that as an intermediate for us, then we need the hours to be extended so that we can have access to that. I wanted to hold the community accountable for the billing part because I heard the $50 copay, and a lot of this we use emergency room care as our means of care. And so a lot of times we don't pay those bills. And those doctors and those nurses, they can't get paid if we don't pay or if our insurance is not paying. So I just want as much accountability as we're placing on others. I want us to have that same accountability for ourselves. That's all.
Actually, correction, Community Capacity Builders works for the Delaware County Health Department, and that mobile unit is ours. So we are the ones that have purchased a mobile unit and we haven't received it yet, but our intention is to serve the community with this mobile unit. And so Community Capacity Builders is out there to hear your concerns, to hear your desires, so that we can make sure that we're meeting you where you're at. So just a correction to that.
No, this mobile unit has been on order for a very long time. Finally, we should be getting it this summer, and that's exactly right. We're interviewing community members and organizations. How can it serve you? It's not going to be the same thing as an urgent care, though. It's not a trauma center. That's what I'm hearing again. So critical here. And I loved your response about that. I wanted to add one thing, that Prospect is on the hook to have an ambulance stay at the emergency room in Chester, even after they're closed for transportation purposes, for exactly this need. People come there because that's the only way they can get there, and they need to be transported urgently. There will be that ALS unit to take them there for as long as that demand continues. So we recognize that that's super important.
Because Prospect has ownership of this business, so our law make concessions that the equipment stays.
So the question is about the value of all the equipment that's in the hospital system, and that is up to the bankruptcy court. We've asked that many things of that. That is going to be the bankruptcy court making that decision.
That equipment is going to sit at those stages that
We have county counsel and solicitor representing us, trying to make that case over and over again, but it's the county trying to make that case.
You may need to repeat the question so that people on this side of the room can hear the question also.
Yeah, there was a question about who is the voice at the table with the bankruptcy court to advocate for those resources. So
specifically equipment, it's easy to bring steps. I'm sorry, but this is important to me because it's easy to bring doctors and nurses and staff. The equipment is part of that sale. So I just want to understand who's at the table to advocate that equipment is not part of the sale to them, that they don't get to use that money to give over to their shareholders. I want to understand who's responsible for making sure the equipment is not part of that sale. That's what I'm asking.
There's not an easy answer to that. We've tried to make the case on the county side. We have a solicitor making statements and doing things, but that is that court. They don't have to listen to any of us.
I feel like for
to acknowledge though, State Rep Curry is here in the room. I just want to say thank you to her for coming. Zena.
I'd just like to say good evening to everyone this evening. Can you hear me? I'd like to say good evening to everyone. I really appreciate all of you have taken the time to come out this evening. My name is Rosetta Carter. First of all, I'd like to give a shout out to DCHD because when I called to register, they picked up right away. And I think that's very important that when people call or residents call, you can't have them going to the answering service or going to somewhere that someone may take their name and, or maybe not. So I just like to give a shout out. So I hope you continue to do that. Also, I have a question for Sheila as well as Meg. Sheila, you talked about if they don't have a primary care doctor or any type of doctor, they could come over to Chest Pen. So my question is, what's your turnaround time as far as appointment? Because many times people are complaining, saying that they can't get appointments.
And I knew someone was going to ask that, so the answer I was giving, right now we're 3 to 4 weeks out.
Okay.
Okay,
but I do have another question for Stan. I haven't, can you hear me?
They didn't hear her.
Okay.
They didn't hear her.
Yeah, I'm going to give her because I'm going to ask Meg, so both of them probably can get their answers at the same time because I don't want to take up all your time because you may have some questions as well. Okay, Sheila?
Right, so for a new patient intake, it's going to be 3 to 4 weeks out before you can get an appointment. 3 to 4 weeks out.
Also, I just like to commend you ladies and all ladies coming out this evening, but you have a lot of great services. And many times people in the city of Chester are not aware of all your services. So my question is, how you plan to upgrade your marketing plan? And also, while I'm standing, I'm going to sit down, Meg. I'd like to know, because your company is located right in the city of Chester, will your center be a place where people can come in to ask about the closure or how to navigate the center? Okay, and also, next time you have something like this, I think they need to invite somebody from Crozier, okay, or Prospect, okay, so that they can answer some of these questions. Thank you, and God bless you all.
Thank you. And Rosetta, I think, by the way, that's my former boss. That's my former boss. But the center is open Tuesday through Saturday. Tuesday through Friday, we'll have 4 people there just helping with, how can we help? Let's go through what doctors are available. Do you need help with changing your doctors? Do you need information on your health care? We'll have 4 people that are dedicated to be at the Wellness Center for just there to help with any situations, help coordinate transportation, help get people signed up for Deldo. We're going to do everything we can to make sure we can help. And my team knows that we use a term called radical hospitality. And if you do not experience radical hospitality, I want you to let me know because we're serious about it.
Yes.
Pass the mic now to State Rep Zena. Senator Marsh.
Thank you so much. Thank you to the County Department of Health so much for being here. Some of you guys may know, may not know, I'm State Representative Carol Kazim. This is State Representative Gina Curry. I represent this district, she represents Upper Darby lands down in the Milborn area. And respectfully, we just, came up here because we heard some questions that you guys had. And I know my office, her office, we plan on facilitating another town hall meeting that would directly go into more of what you guys are asking. But because you guys still took the time to come out here today, I wanted to answer some of the questions that I heard some of you guys mention. So please bear with me. I'm going to try to remember. If I don't get to the question, you can definitely ask, and I'll try my best. Ms. Morales, I think you asked about equipment. First, I think you asked a couple things. First thing is funding. I can't speak to that because that's the county. Acceptance to that. As far as that organization. However, any organization that wants to come in and start providing services, I definitely would love a conversation with them, and I would love for the county to also speak with them, and also the city mayor or any municipality that they plan on proceeding with. Regarding the equipment, that is under the bankruptcy, as the director has stated. But there are some things that has already been in litigation prior to the bankruptcy that has to deal with Widener and other folks who will end up providing that equipment back into the city and also for the care of some residents. So I can't go so deep because it's under the bankruptcy court. So they have another hearing coming up. There was another question, I think, regarding the primary care, or what are we going to need as far as immediate attention. I can't speak for the mayor, I can't speak for council, but I know for myself, I know I've been communicating with different entities that plan on coming in, such as Penn Medicine, DuPont to provide pediatric care, and as far as emergency space, like I said, I can't, this is my words, not the mayor or the council, because these are things that I'm just trying to figure out what we can do to put in place, but also looking into other buildings that exist here or around this area where we can use for emergency services, because I know that it is critical and needed. So I can only, this is just from my mouth. So everybody don't walk out here saying, Mayor, you said, because he didn't say, this is what I'm looking into. Everybody got that part? This is what I'm looking into. I don't want to go and blame anyone else. There was another question, I believe someone asked something about urgent care. Urgent care is not 24/7. Yes, we do have the Silver Care urgent care. However, I do plan on having further conversations with Silver Care because I would like to see their hospital operating, but I'm going to be honest, I don't want it yet operating. It is going to be another prospect part 2. So there are some things that I still have some concerns about, which is why it's not operating in the way that they have already presented yet. So hopefully, if things can get together on their end, then we can have a 24-hour operating urgent care. For the closure employees, because I think someone in the back was talking about the jobs, we have a sign-in sheet at the back. I can't get to it all right here tonight, but I know that there are folks that are going to have to now apply for unemployment claim. That's something we can assist you with. And then as far as jobs, we are definitely trying to work with other healthcare entities to see who is hiring and who's willing to take who, even if you're willing to travel or just looking for other career opportunities. That's something that we can at least try to assist you with or try to connect you with other references or resources. Was there any other question that I missed? Yes, ma'am.
Is there a way that we could bridge the next town hall that you're talking about with the meetings that they started for the block captains so that the community can provide more help with whatever we're trying to do? Because the block captains...
You're talking about the city block captain initiative?
The people who are willing to volunteer for stuff.
Yeah, I mean, definitely, I can collaborate with them. I'll call one of the individuals that's a part of it to try to collaborate that. What I would like to see as well for the next one, for one, I'm trying to help individuals transfer from the Proja system to other healthcare entities. So the goal was for me to bring Mainline Health and Christiana and all these other healthcare systems that are either neighboring around, and then there's also some individuals that are trying to provide non-medical transportation services and also those type of services. I know Council and Mayor right now is working on some next steps as well. Councilwoman Portia West is in the back, so if anyone has any questions about that, but they're working on initiatives. So that was the goal of what the next step for the next meeting was to talk about next steps, but also to find ways that we can start transferring folks over. I know she mentioned about you can come over to the Keystone Wellness Center as of now. If you would like to definitely go there to kind of start connecting, but the goal was for people that probably are having a hard time, or if Prospect is not working with your family to try to get them transitioned, or your loved ones are still in the hospital and you're still not getting no answers. That's where I'm coming in to try to help assist and then get to the individuals that need to push that going, because I know the Department of Health, I believe, is on, the State Department of Health is on the ground in Proja. So I think someone had mentioned Ms. Rosetta Parker, respectfully, Prospect would not be here. So even though we said Prospect or Crozier should be here to answer, they are not, because they're no longer in existence. So I just want to add that piece in there. Prospect would not come.
Well, can you advocate as far as meeting with the judge? Well, they're not. She can make them for a representative. It doesn't have to be for Prospect, but you can suggest that maybe as we have community meetings, it would be nice to have a representative for Prospect or Crozier.
Jean Curry wants to jump into that, because she probably don't.
So, I'm glad to be down here in Chester. I just got off the turnpike from the Capitol. I just want y'all to know, we care about y'all. This is true. We care about y'all. And I know it's very frustrating right now. We're all frustrated. We all live in these communities, and I know we're in Chester, and I know the hospital is in Chester, but the entire Delaware County has taken a hit. That's why I'm here. That's why I'm here tonight, because I need to know. We had DCMH closed. Do y'all remember that?
Yes.
So when DCMH closed, that's right in my district, on the edge of my district, we had Crozier to fall on, right? So we knew that when our hospital closed in Upper Darby, we would, in Taylor, right, in Springfield, we knew we still had this hospital out here that we could get care, right? Now it's gone. We've been decimated. And I just want to acknowledge what has actually happened. We've been decimated. And we've been decimated by Prospect, right? And there's some beautiful employees here that have worked for Crozier that have taken care of us for decades. And so I just want to acknowledge that right now, because I know when we come in the room as community members, we're upset, and I'll be honest, I love the fact that the county is moving in and providing us with the resources, because we need to hear what is happening. But I'm going to tell you, this is unprecedented here in Delaware County. We are experiencing a crisis that we have not dealt with before. So like I said at the press conference the other day, we need to make sure that we're taking care of each other. All of these women up here, thank you today for being here tonight, because we need to understand what resources we have in our community. It's critically important. We know y'all came tonight. Everybody couldn't be here, so I thank you to the Facebook Live. Because everybody can't be here tonight because people are working, people have children, they can't be out here. But we need, as neighbors, because y'all know other people in Delaware County need this help as well. Delaware County strong, and I'm going to say that. And it might not feel like that right now because we're being hit. A desert has been created, okay? And so I just want to let y'all know, our offices, Rep. Kazim's office, Senator Payne's office are right down here for you all. Rep. Kruger's office is over there. Rep. O'Mara, Rep. Borowski, Rep. Curry, Rep. Heather Boyd, Rep. Deloso, and Rep. Vitale, I'm sorry, Havertown. We're all here. The Delco delegation, we're here. Senator Carney's office, Senator Amanda Capoletti, and forgive me if I'm forgetting somebody. But we're the Delco delegation, and we need to hear your voices. Don't be afraid to call our offices, because you might think, oh, this is a community thing. We need to hear you so we can get back to the resources, so that we can continue to talk to our AG, who needs to be. I'm talking to you, AG Sunday. Gina Kirsch. We need to be charging Prospect with criminal activity. Because they have decimated our. So I'm not trying to listen. This isn't political.
It is though. Yes, it is.
I hear you, Tessa. Listen, but let me finish.
You said this is unprecedented, right? But it wasn't unprecedented for Prospect Holding. This was a pattern before they came to Chester. My problem is the people that y'all have at the table, when you make this, not children, but when decisions are made for any community, the people that's at the table with the negotiations, with the bankruptcy, the way that y'all picked them, you
We across Delaware County, like I'm gonna say it to you again, we're all experiencing it. Our healthcare systems are here too. And what I'm saying, and I understand what you're saying, because you know what? The other day on the call, I was saying, what about the mothers who are about to experience birth? Like we already have a mortality rate for Black women that's 2 to 3 times higher, and we're about to experience more. I'm telling you right now, I understand exactly what you're saying. I had a constituent on my call when I was going to the press conference saying, my mom just had surgery, where's her follow-up going to be? We know what you're saying. We get it. And that's why we're here, right? We're here right now with the county to be able to hear what's going on. We need a solution. We need a solution. So, what I'm going to say to you, and I'm glad you just said what you said, because we need to hear that voice. We're not here just to, and I said it's not political because talking about me, I'm not here being political. I'm here telling you that I'm a community member just like y'all. I have kids that go to a school district in Delaware County, and I understand because I pay the taxes too. The reason that I'm here is because I was a community member first, and then I got a job. But that's what I'll always be, is a community member, to hear the hearts and the voices of you all, because I live here too, not just in Upper Darby, but I live here in Delaware County too. And we have a healthcare system that has fallen to pieces. So we need to come together to hear what's happening. And it's okay. I need to hear that. I need to hear what you're saying. And I appreciate you. You know I do.
We're the
representative of governor. Yeah.
I'm sorry, just an announcement too, bro. Oh, you have a question?
I have a question. Bring who? The governor,
Sir, I'm gonna give you 2 things. We're too respectful. We've been trying to talk with the governor's office. I know I've been in communication with them. But I want you to understand that who we are, I'm gonna speak for me right now. Even with me pounding, knocking down the doors, which he knows that I would do, she knows I would do it, and I've done it. I'm telling you that sometimes walking in, how we are looking, they don't always listen and pay attention until you up in there screaming and knocking down doors. So I want you to know that I have no issue still bringing them here. But I want you to know that sometimes, but somebody just made a point about something being political. Sometimes politically, they don't want to jump themselves in there to have to answer questions that we're asking that we did not put nobody in a situation. But what we're trying to do is find a solution. So when I came up here, it was for me to say, this is the next step. I understand exactly what's going on. I'm under Kosher system as far as healthcare. So I'm following you.
I know that gave the 60s. When something happened in Chester back then. The governor of Harrisburg called Nixon in. The next day, Nixon was down on country.
Well, I hope somebody's recording it so we can send it to the governor. To let him know to come down here. I believe there was a lot of people that could have been here right now.
But John McCord said in 1966, if he died, the damn city would die. And it died ever since.
I understand.
And it don't make sense for that to happen.
No, you're absolutely correct.
You're not coming in.
You're absolutely correct. You're correct.
They got to fill out applications. And people take care of one another. But the kids can say this is what you're doing.
I understand, sir. Some people do have some questions, so I just want to answer. And while they answer the question, I do want to make an announcement for those that are, okay, give me 1 second. Those that are under Housing Authority, please know that you must go to the Housing Authority agencies to update your information if you were an employee of Crozier. So if anyone was, just an employee of Crozier, please go and update your information, just because that is very necessary, so you're not still paying the same amount, so they can make sure that they reflect everything accurately. So I just wanted to make that clear.
What about landlords instead of, they're gonna protect you, protect.
From landlords, that's something that I'm trying to work.
They not gonna put them out.
So that's something I'm trying to work on right now on the legislative side regarding landlords here in Delaware County. So that's something I have to talk to county council. Like I said, I can't force the hand of everyone to do something. I'm just trying to do everything the best way I can for my own purview from the state end and see what we can provide. Some things is the mayor going to have to provide, some things the county council is going to have to step in. All I'm trying to do is find a way how I can bridge that gap between council and county council so we can make sure that you guys get everything that you guys need. So that's my hope and that's my prayer. They said somebody.
For the respect for everyone who's here, we did have a couple of people who have been waiting for some time, so I want to get to everyone. We have about 20 more minutes, but I want to be respectful and give people an opportunity. If you have a question, please reduce it to questions so that everyone can benefit from the information that we're trying to share tonight. Thank you.
Sorry. I've been waiting to ask this question. I have a daughter that's bipolar. She's had 3 episodes in the past month and a half because of all the changes and stuff going on. And I know there's somebody in here dealing with the same issue. My problem is I'm asking these people, do they have group sessions for people dealing with children with bipolar disorder? Because it's not good and becomes unhealthy for you, her, and anybody around her. Like changes, like the thing with the president. She takes that, whatever it is that's going on, she'll take it and she'll absorb it for at least a month and a half or 2 months. And see, right now she's dealing with her son getting ready to leave and she's going to be home by herself. So we, as people who have children, and there's a lot of our children here in the city of Chester, I know for a fact, are bipolar. And they need to get help. And you need to get into these schools, and you need to try to look and find the signs. My daughter is 55. She's been dealing with this, and I've been dealing with this since she's been 21 years old. She started changing when she became 18. They said it normally comes when they're 20, 21. When she was 18, she started fighting on. She never fought. She started fighting and everything. It was just too much, for her. And she knew herself, because of the school that she went to get help to find out. And then she was diagnosed with bipolar disorder. And the people that deals with them don't have the patience or the empathy to deal with it. So her second episode was when she had to go to the Social Security office. Different stuff like that we take for granted. It's hard for them. So I know somebody here that maybe need the same type of help that I need. I need a group to go to help me with my daughter and deal with my daughter.
Nami.
So we had a question here.
Question?
Yeah.
Answer.
I don't need a mic.
Yeah, you do.
Hey, y'all done. My name is Chris Mooney. I work with that young lady right there. I work with the Crisis Co-Response team of Delaware County. So I work in mental health and I see Crozier ambulances every day. I see, my office is in Upper Darby, but I see people getting shot. I mean, it's a horrible situation. I get called out when police officers are called out to de-escalate suicides and things like this. But I do have, the one question I had was, Prospect, so I see Crozier ambulances, all around. So I understand that Prospect has to keep an ambulance back, isn't that correct? How many ambulances do they have, and why can't they keep them all back? And listen, I understand this isn't but it just dawned on me when you said that. I apologize. But it just dawned on me when you said, like, if they have 10 ambulances, get them to Chester.
I don't have the exact number, but that's exactly what Tasleen was trying to bring up. Those are assets in the bankruptcy court. So
Right.
they get to decide what happens to those rigs. But there will be the one that, I don't know whether it'll be one of the original ones or a contracted one, that will be at the medical center to transport.
Thank you.
Hi, my name is Lisa Jackson. I'm affiliated with the Crozier Health System. My doctor is a Crozier affiliated doctor. So last week I went to see her and then she informed me that she was no longer going to be able to be my doctor. So not only are we losing the hospitals, we're also losing the doctors that are affiliated with these hospitals. Are the lists available of doctors that we're losing or doctors that I can refer to? Because right now she's not sure if she's going to have a job or if she might go to like maybe Mainline Health or someplace else. But I also want to say we're also losing our burn center, we're losing the crisis center, we're losing all the other places like the imaging center. Because Crozier owns a lot of different buildings, not just the hospital. I mean, the hospital is just one part of it. We're losing like everything. So like my thing is, do we have resources for these doctors? Because I don't know, like right now I have no idea who I should go to.
We are advising that if you talk to your insurance company, they might be able to help, but we can also call our health department. Wellness line will help you navigate providers. It is very uncertain right now where some of these physicians are going to move to.
Do we have a list of physicians?
We don't, not right now. We don't. At health department we don't. I mean, I'm sure Crozier does.
Right.
Insurance company.
But your insurance company will know who's in your network and can help you navigate to a new doctor.
Laura?
Wait.
I'm going to ask her the question, I'm going to tell her to tell me. Okay. I also want to just the
Vermia, yeah, it's resources in the region, it's not the same thing as having it right here. Yeah, the medical records piece is what she's bringing up, and we get that question a lot.
Okay, no problem. Good evening, everybody. I'm Dr. Montrose Monson. I worked at Taylor Hospital for 44 years. I just retired 2 years ago. My question is, we can't never let this happen again. So I want to know what is in place legislatively to make sure that we never have another private hospital take over another non-profit hospital. You can't have it. So that's what my thing is. That's what I want to do. I went to Taylor yesterday. I went to Crozier today to see some of my friends, and everybody is crying. We're all getting devastated here. And it's such a shame to have, and we only have 2 burn units, y'all. We only have 2 burn centers, Crozier and Temple. And that's for the whole state. So it don't matter where you live. They can't look at Chester and say, oh, well, Chester. It's everywhere. If you have a doctor, Governor Shapiro just had a fire in his house. And thank God he didn't get burned, because guess where he would have to end up being? At Crozier, Chester, or Temple. Because we don't have what to. So that's what I'm mostly concerned about. Making sure this don't happen no more. No more profit companies coming in here and nowhere else trying to take over health care. Because they're not for us. They're not for us. They're not for us. So that's what we gotta make sure happens. We got some laws on the books, get them passed through so that we don't have to deal with this again as a community. So that's all I wanted to say.
We're all switched about here.
Can I answer her question?
Yes. So you gotta get untwisted though.
Wait a minute.
We're going all the way over here.
Okay, so to answer your question about the legislative piece, we already have 5. The problem is Senator Pittman, who's in the Senate, along with a few other Senate members, keep blocking it. Curry and I are on it together. All 5 of them was introduced way before this was happening. Because we were having conversations way before this happened. When that hospital closed, I kind of already knew they was going to try to, and when I started seeing what was happening in Hyman and everywhere else, 5 different legislations, they kept blocking it. Why? Because we have individuals who are in leadership that wants these privatized entities in place. Now, my call is to the governor to talk to the Senate and to block that from happening. Along with, when I said in a panel that we had about a month ago, the Department of Health now being involved, the State Department of Health being involved, that prior to them coming, they have to look into the entity that's coming in and do an assessment on them. Prior, before them receiving a permit.
What happens is that once they already receive the permit, the asset is already sold. Even if the municipality agreed to or don't agree to it, the Department of Health may then come in to make sure everything is operated properly. It's supposed to happen properly. Do I believe that there's a lot that should grow from this? Absolutely. So as I said before, like I said to the governor, I hope they've all learned their lesson. Because none of this should happen. In Scranton right now, they have the same process going on right now. And it's not under Crozier. It's not Prospect. So that should let you know what's going on. So these individuals are blocking these legislations because they're in it for the money or because they have friends that have these companies that want to take over, and that's where the block is coming in. So I have no issue putting in legislations. Listen, I'm here because I care. My grandmother just passed last night. And I came in here when I'm supposed to be with family. And I care because she was also there at Crozier. I dealt with issues with Prospect. And unfortunately now she's gone. So I understand it. So I just want you to understand that I'm personally invested in it, along with me also being a resident, along with my children also being under Crozier health system. So we tried to put some legislations in, but they're blocking it. But we would love your support. We're trying to call Senator Pittman's office. We can try to get the number for you to try to come up to Harrisburg sometimes, or
They're back in session on the 5th, 6th, and 7th. May 5th, no, the Senate is back in session on May 5th. They haven't been there since the 1st of April. May 5th. And I'm telling y'all, we're heated about this because we did try to put things in place. But the Senate, a lot of people don't know the civics behind it. We are in the majority in the House. We are not in the Senate. And so anything that goes up through the House, you'll see it. You can track it on the website. You can track where the bills have gone. They get up to the Senate and they drop.
and that's really the truth on how the legislation process works. So as I said, my next step is trying to find the solutions. I know that there were some moms that came in here with children. My concern is also the moms that are supposed to be up for delivery, who's now been canceled. There has been people calling my phone. I'm trying to navigate them to now into Mainline Health. I'm trying to make sure individuals got transportation because they're scheduled for C-sections within next week. So it's a whole lot going on. We got seniors that were supposed to get surgery, other people that were supposed to get surgery. They called me. When I tell y'all since, I haven't been able to even process my grief yet because I'm trying to make sure people can get surgeries done. And people are getting calls saying, we can't do your surgery. Life-threatening situations that they're going through right now, they're being told, we can't do your surgery, and they're calling and canceling. So I'm trying to call Jefferson Health. I'm trying to call people that can get to step in and provide surgeries and so forth right away. So I just want y'all to understand that it's not something that's going to happen overnight, but I can assure you that I'm doing my best, and bear with my office, please, because we getting pounded with unemployment claims now. And it's no fault of anyone, but this is where we get frustrated. Because as you stated, sir, the governor should be here. And even though the governor's office was working, even when I was pounding saying push more dollars, do this, do that, they're not going to want to always hear that. And the truth is, even if I continuously kept pushing, they were taking and not putting it back to the hospital. They were taking the money, stealing it, and keeping it for themselves, being a corporation and administration. That was the problem I had. In addition to that, I'm also taking away further from all the organizations, our police department. They won't need money to get out on the streets. We need first responders. I can't keep pushing the dollars and taking from nothing. That's what happens. I'm telling you the truth. It takes away from my budget to make sure that they are funded. And right now, I can't even tell them what I can offer because it took away from me. You understand what I'm saying, sir? So right now, on top of that, because we have said yes, governor, that throws extra, the relievement, so my district won't suffer behind all the organizations and first responders that need money. Yes, what is they going to do? Will they listen to us? No, for whatever reason. So all we can do is do the best that we can here. I'm frustrated. But I just want y'all to understand that legislatively, yes, and we're going to do what we can. And I think some people have some questions.
Okay, my name is Deborah, and I think it's a simple question. I'm hearing all about the different, avenues that we have, resources and everything, but I'm speaking on the patient side. How are we facilitating medical records for the patients as well as, I know that they have people, the patients can speak with their, as members of the insurance. They can go and get the different PCPs, primaries, and different specialists. But I'm saying, in order for them to move from one entity to another entity, they still need their medical records, and how is that being done in order to facilitate within that 30-day window that's supposed to do?
That is a very important, very critical question. There's a couple things about the medical records, right? For the hospital records, there's a phone number that you can call, and they will release them to you. If your physician moves to another practice, and you're staying with them, the records will go with them. So there's also a patient portal that Crozier patients can log into. We have that, you can give you that if you call us. You can also try to get your records that way.
Just to add to that, please understand that you have the right to access your patient records. Every single individual, whether the hospital is closing or not, because of HIPAA, has the right and should have their patient records. So I encourage all of you to call your providers and ask for a copy of your records now. If you are with the Crozier system, there is a number that you can call to access your medical records. There's also a website. You can get it from us tonight, or you can call the Delaware County Helpline, and we will provide that to you. For doctor providers, there you will have to ask your provider for your records. However, Crozier will be providing us steps on how you can access your records. It is vitally important that you do that as soon as possible. However, with your medical records, you will be able to access that far beyond them being closed. But I encourage you strongly to get that ownership of your records, as that is your right.
Good evening, everyone. My name is Bernetta Wright, and I'm a constituent service advisor for State Rep Carol Kazane. There's also a website. I just did it today. It's a lot easier than trying to call that phone number that nobody is realistically going to answer. If you have an ink pen and or a pencil, or you can call our office tomorrow and I will gladly share this information. Amen. Amen. Would you like the email address? Yes. Okay. The email address is https:// the word request manager. It's all one word. .healthmart.group.com. It's a very, very simple way of accessing. All you have to do is go on there and put your date of birth. You check off what records you need. If you need all of your records, just check the box, put your date of birth, your email address in, and that's it. Realistically, if you call that number, nobody's going to answer.
Excuse me, y'all. It's another place you can go for your records. It's called HealthLink. All right. So my question is for any insurance company on the panel. So I have Medicare, and that's a blessing to me and my family and our finances. But for the people who have Medicaid, already, if you need a specialist and you have doctors at Crozier, the specialist will say that they're out of network. You can't even find a dentist that will treat you because they're all out of network. So, for temporarily, is there something legislative that we could do that would grant people prior authorizations to get treatment in other places? Because the prior authorization won't be granted unless they have a plausible reason to grant it.
If you're a Keystone First member,
I'm no longer, my children are, but I'm
but
not.
if your children are, please call our member services, and you can come right here.
Ma'am, it's outdated. All of the information that you give me over the phone, when I call and I say I need a dentist, you'll give me 10 numbers. They are all outdated. Some of them, it doesn't even go to anywhere.
Come talk to me as soon as this panel's over. I got a few right here in Chester.
Well, I don't need them. Other people are going to be needing them.
Yeah,
Other people are going to use their insurance card and call Jefferson. Example, excuse me, I'm sorry. Example, United Healthcare. The entire temple does not take it. Where do you go if you got United Healthcare? Nobody wants it.
I can only answer
I know that
Keystone First because I work for Keystone
But you understand what I'm saying? People going to have major problems because nobody wants Medicaid insurance. They don't want to take it. They're not getting paid.
We'll talk to the Department of Health.
Yeah, I was going to say, but that's something that we're already trying to talk to them about, and I've already been trying to have conversations with Temple, Jefferson regarding those specific insurances, but that's something that they have to also work with the insurance company. Like if you have AmeriHealth, I'm currently right now working with AmeriHealth to where we can be able to get them service and where they can do that. Because it's not just Medicaid, it's also those Advantage plans.
Right.
That's what I'm saying. You're on Advantage plans. That's why nobody takes that
So
stuff.
all of them, we're trying to get them transition, but it's also up to the insurance company as fast as possible as they move to try to get them to get accepted under those incidents. So that's the only way. You can still be seen by them, it's just unfortunate, like you said, the cost.
Right. I was just trying to come up with, see, I'm okay, but I know a lot of people around me have these issues, and what are they going to
Send them
do?
to the Wellness Center. If they're on Keystone First, send them, even if they're not, send them to the Wellness Center. We have 4 people who are trained, and before they leave, we are practicing radical hospitality. Before they leave, we are making sure we can get an appointment, okay? Honest.
One of these I wanted to tell everybody, it's not hard to remember, but if you want to be kept in touch about job opportunities and job fairs, please text health jobs, one word, health jobs, to 888-777. That's health jobs, the word together, health jobs, to 888-777. And then you will get information texted to you about job fairs that the county's going to be doing and other resources to find workers.
And I will, can I add on what the department is doing?
But I was just going to add, we have a transition center run by PA Career Link. It's going to be opening up starting May 5th. They're going to have hours from 8:30 to 5 and also evening and weekend hours will be scheduled. It's going to be at 160 East 7th Street in Chester. So it's going to be an ongoing open office for job resources. There's also going to be a closer job and resource fair at Subaru Park on May 13th. I'm going to give out there's going to be rapid response meetings for securing employment, health insurance.
So from April 30th through May 7th, the Department of Labor will be running rapid response sessions for any employees of Crozier. What's going to happen at those? You'll find out about health care insurance, you'll find out about unemployment. The Pennsylvania Career Link's going to talk to you about what kind of funding might be available for additional training. And those sessions will happen virtually from April 30th until May 7th. And then on the 13th of May, we'll be hosting a huge resource and job fair for anyone that was affected by this closing as far as employment is concerned. It will be at the Subaru Center. The health department will have all of this information.
2 more questions we're going to take, I think, before closing out.
Yes, two final questions. She already asked me a question. Oh.
Well, that's right.
Did you get your question?
If anyone, real quick, anyone, if you're going to try to request your medical records and you are asked to pay a fee, please contact our office because we're trying to get that waived, being as though we know you guys have to transfer to different systems, but also know that they have a new system now where a lot of doctors do have access to see a lot of your history. Even if you was to go to Riddle, they can even access some of the stuff and still see it. So know that there is some healthcare system that actually does have access where they can still see your medical history. But if you want it for your own copy, just in case, if they ask you for a fee, please let us know so we can try to get that waived. Because there are some medical records that's in charge,
want to make sure you guys are not charged for the sake of everything that's happening. So I just want y'all to know that.
One question was, it was hard, we mentioned a lot of things tonight, and it was hard to keep track of it, right? We try to put as much as possible on the Delaware County Health Department Prospect website. So you can just put it into Google, put in DCHD Prospect, you'll get to our website, you'll get links about the medical records, about Delco, about all these things. Or you can just call, and doctor information's up there too. All that stuff. And you can also, if you get confused, you just want to talk to somebody, just call the health department. Very, very, very happy to talk to anybody about any of this. Okay? And there's the numbers for that.
Finally, I know that maybe some of you have questions that we were unable to get to. Please feel free to come up and ask any of our representatives. There are also representatives in the audience, and there are members of BCHD here. If you were unable to do that, please feel free to call our wellness line, in addition to a host of resources that are in the back. Again, the point of all of us being here was to ensure we should provide you with the information. So please feel free to come up to us. Thank you all for coming.